So the reason to have a hip replacement is for bone-on-bone arthritis. It's for a hip that's worn out to the point that you can't move. The question I always ask people is, what would you be doing differently if your hip felt better? For this surgery, I use the HipXpert computer navigation system. It's a patient-specific mechanical guide, also called a smart mechanical navigation. With computer navigation with a HipXpert, the doctor's getting it right closer to 99% of the time. I get a CAT scan a few weeks ahead of time. I then get a three-dimensional model that shows me how all the pieces fit together. So I'm able to plan out the surgery in 3 dimensions 2 to 3 weeks ahead of time. So by the time I get to the operating room, I know exactly what to look for, I know what the potential pitfalls are, I know what my goals are, and the patient can have the confidence that they've done everything they needed to do in order to get the best outcome. I mean, the goal of this hip replacement is the goal of all hip replacements, and that's just to relieve pain and to restore function. And one of the most rewarding parts for me is I get to watch them walk out of the surgical center that same day, not in a wheelchair, but with their own crutches or a walker. The thing I'm most proud of at Reconstructive Orthopedics is we really treat you as a whole person. So we're going to listen to your goals, we're going to select the operation that's right for you, and we're going to be there with you every step of the way afterwards.